Welcome to Mental Health Now. My name is Kim McDevitt. I'm the Executive Director of Mental Health America of Lancaster County. And today's topic is mental health in the LGBTQ community. And we are honored to have with us Jami Dumler, who is the Regional Clinical Director for Thriveworks Counseling, and Tiffany Shirley, who is the President of Lancaster Pride. Thank you for joining us today.
Thank you.
So this is a very important topic, and I know we had the privilege of having an extensive conversation on Friday evening about the LGBTQ community and some of the challenges within the community regarding mental health. And, you know, I learned just in talking to both of you a lot about the struggles. So, and this has been very educational for me. I know our team at Mental Health America is very good at supporting everyone, and I think just learning a little more about this community in greater depth was very helpful to me as well. So thank you for that. So according to the U.S. Census Bureau, the LGBTQ community members experience mental health at 2 times the rate of their non-LGBTQ counterparts. Why might mental health challenges impact the LGBTQ community at higher rates than others?
We know a couple of factors, absolutely. Okay. There was a recent study in 2022 from the Trevor Project that looked at LGBTQIA plus youth. And one thing that they found was that being part of a marginalized community, they face things that their peers just don't have to worry about, right? Bullying, discrimination, changes in our world today, challenges accessing mental health care when they need it. And so that's just even to name a few off the bat.
And what would you say, Tiffany?
I think to go off of what Jami says, there's some different struggles that we go through, including just family support. Some people don't have support from their families when they come out, when they feel safe, and when they do feel safe, those families make them not feel safe, and they don't have that support around them, especially with professional mental health help. So it is a huge struggle for some people.
Yeah, in the next segment, we'll talk a little bit more about how families can support and some, you know, really compelling data to speak to how we can improve the mental health of those, just the family that can support them. And but, you know, 3/4 of the LGBTQ youth reported experiencing symptoms of anxiety, and 58%, over half of the LGBTQ youth have reported symptoms of depression. That's pretty astounding. What are the factors that increase the rates of mental health challenges for youth?
I think a lot of it is sometimes when they go to school, they may feel safe at school, and then when they feel comfortable to let teachers know or peers know that a name change, a teacher will out them to their parents when they're not ready to go to their parents. So they almost internalize that and are afraid to come out as their true authentic self. There's teachers who don't understand things that they're going through. They think it's just a phase and just dismiss these students' feelings.
So they become confused, maybe?
Correct, okay. Yeah. Even school districts, students don't feel supported by their school districts, and if they are in a more conservative school district, they're in fear of being taken, you know, that the teachers will go to students' parents and out them, and you know, when they're not ready.
That's scary.
It's very scary.
Yeah.
And then also just peers. Peers are mean, and some children don't understand what the queer student is going through. And bullying is huge. It's sad. So it you know, there's so many things that a youth queer person would go through that a straight student wouldn't have to go through.
Absolutely. And even just to pull that out from the youth community, for adults too, your workplace, your community, just do you feel safe walking around your neighborhood? I've spoken to so many clients that, you know, have to think about that when they're traveling. When I travel to this location, is it going to be a safe space for me to just be myself in? So I think those are challenges that both youth and adults face, especially if you're trying to pull, you know, different aspects of yourself, not just your gender identity or your sexual orientation, but religion, community, all of those pieces. As Tiffany mentioned, feeling safe is just a huge piece. even things like, can I bring my partner around my family and friends? Do I feel like people support how I want to be called on, name, pronouns? All of that goes such a long way. And then our world is always changing, in any season. But I know legislation plays a role too. Am I going to have access to play sports in the future, or mental health care, or health care that I need if the world kind of shifts or changes? So all of that definitely plays into anxiety and depression.
And you had said something about they have their own trauma. Can you expand on that a little bit?
Yes, for any marginalized population, meaning not like the majority in their home or area, they're more at risk of facing things like bullying, discrimination. It's a pretty staggering statistic, but I believe it was about 50% of youth report that they have been either threatened or actually truly assaulted or physically harmed in some way. So if you know that that's a statistic your community faces, or you've faced that yourself, that is trauma. Even COVID-19 is a trauma that we have all been through. So even COVID-19 plays a role. If you weren't in school and that was your only safe space, as Tiffany mentioned, you just lost access to that for quite a bit of time. Right. So it can definitely drive up those mental health factors and those trauma pieces.
Right. Thank you. Thank you. So 83% of those in the LGBTQ community have expressed that they wanted help, but only 60% who wanted help could gain access to support. What are the barriers to mental health care?
Insurance. Insurance is a huge thing, especially if you don't have access to insurance, you don't have the accessibility to get to a state program to get insurance. There's many factors in why a person doesn't have insurance.
Well, and also if you're relying on your parents' insurance, right? So how do you, if they don't know, if you haven't been outed yet or you haven't come out, how do they know? Or how do you approach your parents? Because you need support, right?
Right.
And insurance
use
aside,
their insurance. Yeah.
you need parents' consent to join therapy if you are under 18. Some states it's under 14, but still we're talking about minors. That's a really big challenge if your parents aren't supportive or don't know about your identity.
Yeah, so one thing we just became aware of is if you are 14 or over, you can seek help without parental consent.
In Pennsylvania,
In Pennsylvania now, yeah. So, and I think we talked about lack of affirming therapists. So you shared that therapists can say that they're specialized in LGBTQ, but they're not.
Correct. It's very common to see LGBTQIA plus on someone's profile as their approaches or just that they're a warm space, but many don't have specific training around that or don't stay up to date on training terms, how things have changed. So really important to find someone that's been endorsed by either a club in your area like Lancaster Pride or WPATH for transgender care is another great space. They have a whole member directory so that you know 100% that someone is specifically trained and able to provide that safe space.
Right. So Lancaster Pride, a little bit about what your organization does. Can you share a little bit just so the community knows and can use you as a resource?
Yeah, absolutely. So Lancaster Pride is a celebration of queer culture, the LGBTQ community. So once a year we have a huge festival. We bring thousands of people into the city, and I always like to say we're a huge resource. We have queer vendors, we have nonprofits, affirming nonprofits, queer nonprofits. We just have a whole bunch of people in one room one day that if someone don't have that access or the accessibility to find something that they need, we're giving it to them in that one day. But that just because we do it for one day doesn't mean we don't do it for the rest of the 364 days of the year. If we have a lot of people who come to us who are homeless or in need of immediate help, we're able to connect them with an organization that can help them. So I never want people to deter to think that we're just a party. We're here to support our community.
So you provide a safe place.
Yes.
In the next segment, we will talk about, the harassment and some of the threats against LGBTQ community, and then we'll delve into supporting family members and supporting in the workplace.
Great.
welcome back to Mental Health in the LGBTQ community. And with us today is Jami Dumler and Tiffany Shirley. Thank you for joining us. We know historically that marginalized communities and groups such as the LGBTQ community tend to be more at risk due to mistreatment and stigma. In fact, 36% of the LGBTQ youth and others have reported they have been physically threatened or harmed due to their sexual orientation or gender identity, and 31% reported that they've been physically threatened or harmed due to their sexual orientation. Even today, despite increased awareness and social acceptance, I wouldn't expect those high numbers of bullying and harassment and discrimination. What can we do to reduce the stigma and harm in systems like the workplace, faith communities, healthcare?
I think moments like this where we're getting, out there and talking about the community, raising awareness and understanding is huge. That's the whole idea behind Pride Month, right? Is the more we talk about it, the more we bring awareness, the more someone knows, the more they lean towards acceptance. I think for a lot of folks, it's discomfort, it's ignorance, and so learning is a huge piece of that. I think representation is really big as well. If you work in a workplace where no one higher up identifies like you do, that already starts to create a different culture than if you see people that identify as LGBTQIA+ in your workplace itself, even in the higher up ranks. So representation, awareness, talking about it, those are all just steps that we can take towards that goal.
Education is critical, right? So I think and the DEI trainings, I think they're essential as well. Tiffany, do you have anything to add?
For sure. If you see something, say something.
Yes.
If you see someone saying something that's not appropriate, not right, say something. Don't attack them, just educate them.
Right.
Sometimes people say things because they're not educated on what they're saying.
That's a good point. So many times people are critical or they become defensive while the other person, maybe they just made a mistake or weren't educated. So I think that sensitivity and understanding for each other is really important because we're all learning and we're at a different point in our journey in learning.
For sure.
And I think what I've seen, especially when working with communities, people aren't intentionally trying to, insult someone. It's just for their lack of education. I think that's why these sessions and others are so important. So, the LGBTQ have felt youth who have felt social support from their families reported attempting suicide at less than half the rate of those who felt low or moderate support. So that's pretty staggering as well, right? So what can families do to support their loved ones? Tiffany?
My first one is just love them. Love them for who they are. They were born that way. It's not a choice. So just telling them that you love them and you support them is number one. When I came out, my mom just told me that she loved me, and that's all that meant for me. And I felt safe to come out to others because your family is the number one, the scary family to come out to is family. So when your family supports you, it's easier to come out in other ways.
And then you can get the support you need if you need it.
Yes.
Yeah.
Also, just, your family can become educated. They can go to therapy and talk to people because family sometimes feel like they're losing you, which is not true. They're just learning a different part of you.
Or maybe in their mind and that happens a lot of times with even a child that may not be in the LGBTQ community, right? But you had high aspirations for your child or different aspirations for your child. So I think it's that understanding too. Right?
Correct. Yeah. So if you go and learn and become educated, you can support them better.
And just to add to that, I think it is really important for parents that are maybe struggling or don't quite understand or don't have any past experience in their parenting approaches to seek therapy, because therapy gives you a safe space to talk about maybe the harder aspects of like your child going through or sharing this change. And it's important that they have a space to process that so they can be loving and supportive, but to process that on their own away from the child, right? Because if they try to process those difficult feelings or the things they're trying to hold on to with the child, it's damaging, it's trauma.
Okay.
So to get your own safe space to kind of process, sometimes grieve in a way of what you thought versus what's going to be, so that when you turn to your child, you can only show that love and support and still have conversations, right? I think parents can have conversations with their teens and kids on like understanding their choices, understanding how they feel, choices in terms of like what they want to do, who they want to date, but in that conversation to always be supportive and curious and not judgmental. I think the approach is very important.
Because that pushes them away. Can you tell I'm a mom of 4? So, so, we do at MHA have the CMAP program, which is the Community Mental Health Assistance Program, whereby we offer 3 free counseling sessions to individuals who need support, and we can connect them to over 65 therapists. So we want to be able to use that as a resource, and again, connecting them with affirming, specialized, therapists in the community. So most recently, more than 4.5 times as many, and this is, I'm focusing on the youth for this because we are really focused on upstream as well. So as many LGBTQ high school students reported attempting suicide in the past 12 months compared to non-LGBTQ students. What can schools be doing to identify and support students that are struggling?
Creating a safe space definitely is important. Having different clubs, different mentors, guidance counselors that not clients, students, I work with clients, can go to when they're struggling or need support. I think as Tiffany mentioned earlier, culture of if you see something, say something. If the school doesn't help address bullying concerns, they're not going to feel safe to tell anyone about it, right? So really having an anti-bullying, no tolerance policy and backing that. And then I think really equipping teachers to understand different LGBTQIA plus terms, the use of appropriate pronouns and names, and collaborating with parents where able, where the child says, I've come out to my parents, it's a safe space. Have that collaboration of how is the child doing? Do they need mental health services? Can we help you access those services? I think if we can create that like wraparound system for youth, that's going to be really important.
Great. Anything to add, Tiffany?
I always, tell my fellow teachers, sometimes even just putting a pride flag in your room shows that student that you're a safe space.
Okay.
Yeah, so if they see the pride flag, they know that you're an ally, and they may feel a little bit more comfortable to come to you if they are having issues.
Good. Yeah, both of you mentioned it's the small things in our conversation on Friday. It's the small things that can really make a difference. Can you share what some of those small things might be?
Making sure that you use the right pronouns. If you're meeting somebody, introduce yourself. Hi, I'm Tiffany, Shirley, she, her pronouns. And that kind of triggers that person that you are understanding of the pronouns, and they will introduce and tell you their pronouns. And then just try your best to use those pronouns. People are allowed to make mistakes. I've made mistakes, but I've always made it a point without making it a big deal. So if I accidentally use the wrong pronoun, I'll say, oh my gosh, I didn't know she, and then that'll cue me, and then I'll go back and say, oh my gosh, I didn't know they. So that way I'm not making a huge deal that I used the wrong pronouns, but I acknowledge to that person that I am sorry and that I used their right pronouns.
That's important to get that right.
Yeah.
Absolutely. Even in the workplace, when someone's new and onboarding, to ask them their pronouns and not assume them. If you're seeing someone by email only and never met them in person, don't assume based on their name. I think other important pieces besides, pronouns and name is as Tiffany said, representation. Like even just putting up a pride flag, even just, sharing experiences, sharing that you're a safe space is important to start that conversation. Getting involved in your community, go to Pride Month events and explore and see what the community is like. I think when people step into it in real life and not just on paper, they see all the love and all the fun and all the acceptance, and that's something that's going to spread. You know, when you experience that, it ignites that awareness and that passion, and you're going to help other people in your world to be more accepting, right? To be able to correct them when they use the wrong pronouns, or help start the discussion when there is ignorance and misunderstanding. So get involved.
Get to know the person,
Yes,
right? So
right.
I think
it's not their only piece of their identity.
Exactly, and I think that's something that we really struggle with in every marginalized community. Get to know the person.
Yeah.
So what more is needed, do you think, to support this community? And I think you mentioned support groups,
Yeah.
and therapy, more specialized therapist, and just awareness.
Yes, therapy as a whole needs more therapists, and therapists especially that go through that training and ongoing education. Definitely support groups, even at like the community peer level, but also the mental health level. And I think even support groups for family members or for teachers, right? Like helping the community that surrounds and that upstream approach of if we can help get a more accepting space, then we're going to help those youth and those adults too.
Great, great. Well, thank you to both of you for joining us in this very important conversation. Thanks for joining us at the Mental Health Now. Let's keep the conversation going.